I am Dr. Saurabh, and today we will see about the cyanotic spells, which are also known as the TED spells. So what is cyanotic spells? So cyanotic spells are nothing but the sudden paroxysmal worsening of basal cyanosis with dyspnea, altered sensorium and occasionally seizures. So what is the pathophysiology of the cyanotic or TED spells? So basically you know that on the right side there is oxygenated blood, and on the left side of the heart it is the deoxygenated blood. So basically there is increased right to left shunt, that is deoxygenated to oxygenated shunting. So it is precipitated by various factors. For example, if the child is crying, if there is any decreased systemic vascular resistance, and because of the spasm of right ventricular outflow tract. So what is this right ventricular outflow tract? This is nothing but the subinfundibular tract. So let us see what is infundibulum. Infundibulum is nothing but the muscular outflow tract of right ventricle. And the spasm of this infundibulum is the main precipitating factor in cyanotic spells in TOF. So the right to left shunt is increased, which will lead to hypoxia, hypercarbia, acidosis, cyanosis, and also the murmur will be shortened or it will be absent. So all this will lead to the increased depth and rate of breathing, which is known as the hyperapnea. And because of this hyperapnea, there will be increased systemic venous return. From the superior vena cava and inferior vena cava, the blood flow to the right ventricle will be increased. So again there will be right to left shunt because the outflow tract is already obstructed because of infundibular spasm in the right side, and also more blood is coming to the right side. So eventually the blood has to shift from right to left side. So it will again, the cycle will continue. So this cyanotic spell is seen in the tetralogy of Fallot, and the most common age group is less than 2 years and in anemic children, and the most common is 4 to 6 months it is seen. And let us see the treatment of cyanotic spells. So basically in treatment we have to manage the things which are occurring in the pathophysiology. So first of all, at home what you can do at home is squatting, that is the knee chest position. So it will, by this knee chest position, it will increase the systemic vascular resistance and it will decrease the systemic venous return. So there will be decreased right to left shunt. Then to combat the hypoxia, we have to give 100% oxygen, and this morphine we have to give IV or subcutaneous in the dose of 0.1 to 0.2 mg per kg for this hyperapnea. So what it will do, it will decrease the respiratory center and relieve the anxiety and metabolic demands. Then to combat the acidosis, we have to give sodium bicarbonate at the dose of 1 to 2 millipillion per kg, which will neutralize the acidosis. Then beta blockers such as IV propranolol given in the dose of 0.05 to 0.1 mg per kg, which will cause the systemic vasoconstriction. And the alternative for this propranolol is phenylephrine or methoxamine. So this is the medical management of TED spell or cyanotic spell. But if it is not managed by the medical or drugs, then we have to do the surgeries. So there are mainly 3 shunt surgeries with the name of Blackop-Tossing shunt, water shunt and port shunt. So in all this shunting, the common is pulmonary artery. So this we have to connect this with the subclavian artery. It is known as the Blackop-Tossing shunt. In water shunt, we have to connect the pulmonary aorta to the ascending aorta, and in port shunt, we have to connect the pulmonary aorta to the descending aorta. So there is one mnemonic for this: bus wahan pahuncha do. So B is for Blalock, S for the subclavian artery, then W is for water shunt, and A is for ascending aorta, P is for port shunt, and D is for descending aorta. So this is all about the cyanotic spell, also known as the TED spell. So hope this video was useful. Thank you.